We have started our class. Welcome you all. Today we are going to continue our introductory class about ENT. Can you hear me? If you can hear, please make the comment. And if you cannot hear me, let me know whether you can hear or not. Can you hear me? If the sound is okay, then I will start. If sound is not clear, then let me know. Yes, okay. Okay, thank you, Bornil. You have responded my question, and rest of all you, whether are you uh, just connected with us, you are not following my instruction, please, make your sound connected with your device and so that you can hear all my topics. Today, I will want to discuss the previous parts of my previous part of my lecture. What are the what are the common ENT conditions? What are the common ENT conditions? We are we will discuss this thing. The conditions of ENT. We have previous lectures. We have discussed the matter of how we examine the ENT disease and how we think about the ENT diseases. Now we will talk about the conditions, the phenomenon of problems that ENT people deal with. And in your ENT class and in your ENT course, you will be learn about this thing. There are different issues in ENT like ear, nose, and throat. And the vast majority of the ENT is the head neck, especially head neck cancer. In the ear, we have diseases like external ear disease, the otitis externa is a very common phenomenon. For the middle ear, otitis media, and the inner ear, there are different issues of inner ear like tinnitus, vertigo, Meniere's disease, vestibulitis, different issues in the inner ear. That will be discussed throughout your course. And the condition of the ear that makes the conductive hearing loss in the otosclerosis. These are the common ear diseases. Just orientation of about the ear diseases. Nose and paranasal sinuses. Some diseases remain in the nose, like rhinitis. This rhinitis may be the allergic rhinitis or other form of rhinitis. This will be discussed throughout our ENT course. And the nose, there are some polypoid masses, polypoid lesions in the nose. Sometimes there are some tumorous lesions like cancer in the paranasal sinuses, the malignancy of the nose and paranasal sinuses, and the some form of the benign diseases like the deviated nasal septums. These are the common diseases of the nose and paranasal sinuses, and some form of the throat conditions that you have to encounter during your course, like the infection in the tonsils, infections in the larynx, throat, infection in the pharynx, and different issues of the voice, change of voice. Yeah, you can see the voice changes in different conditions. The people who speaks a lot, they may have some problem in the voice, and some form of the laryngitis may change the voice And the laryngeal cancers. The laryngeal cancers may cause the change in the voice as well as the problems in respiration and the problems in the swallowing. These are the conditions of the throat and head neck, especially in the neck region. There is the thyroid, location of the thyroid. Different forms of the thyroid disorders, like the thyroid tumor, the goiter, the hyperthyroidism, hypothyroidism. Different issues of the thyroid is taught in the course of the ENT, and some other glands in the neck, the parotid glands, the submandibular gland. These are the salivary glands. The salivary glands also has some form of the problems, some swelling, some benign tumors, some inflammation in these salivary glands, and other head neck conditions like developmental anomalies of the neck, infections in the neck. These are the conditions of the ear, nose, throat. These are the common conditions. Yeah, throughout your course, we will discuss about this thing in details. In details, there are four segments of our ENT: ear, nose, throat, and head neck. Throughout our course, we will discuss these four topics, and the conditions. These conditions are form of the diagnostic tools. When there is some diseases, you go to the physician and you have to check the history. You have to do some physical examinations. In the ENT, we have to take some, when there is some problem in the ear, some problems in the ear, you have to take some history from the patient. Then you have to do some examinations of the ear. After doing these examinations, you sometimes you will need some investigations, some diagnostic tools that will help you to make the diagnosis. First of all, for the ear, we need some form of autoscopy to see the ear. What is seen by the naked eye, some form of the speculum, the oral speculum uh, can be helpful to examine the ear in details. But the oral speculum, ear is very small structure, and the oral speculum setting in the ear can help to visualize this thing in the real shape. But when we have to need some magnification, then we can use such a type of instrument that is known as the otoscope. This otoscope will help you to see the tympanic membrane in detail. Here is a tympanic membrane. This is the right tympanic membrane. This tympanic membrane is seen through the otoscope. Nowadays, there are issues of endoscope. Endoscope can be seen uh, in the ENT examination tool. With the endoscope or the otoscope, you can see this type of images where this round part of the image is the external auditory canal, and this is the tympanic membrane. Can you see my cursor on the screen? Can you see my cursor? Can you see my cursor? I'm demonstrating the tympanic membrane with the cursor. Can you follow this thing? Here is the here is the external auditory canal, and when there is end of the external auditory canal, there is the tympanic membrane. Do you have any language problem? Can you understand me? Nobody hearing me? Nobody hearing me? His sound is okay? Can you hear me? Can you follow me? Here is the cursor. I'm demonstrating you the I'm demonstrating you the tympanic membrane, what is seen through the otoscope. What is seen through the otoscope? Here is the picture. This picture demonstrating the right tympanic membrane. This is the handle of Malleus. Here is the handle of Malleus. Handle of Malleus. This handle of Malleus is the mark through which we can identify whether right or left. In the right tympanic membrane, this handle of Malleus direction upward towards the right, and in the left tympanic membrane that will be remain in the towards the left side. Okay, this is the right tympanic membrane, and here we see there is a blistering area. This area is reflecting the light what is sent through the extraordinary canal through the otoscope. This reflection of the light in the anterior inferior part, the name of this area is the cone of light, nothing else. This is the anterior inferior part. This is the anatomical significance. This is the thing that make you to feel that this tympanic membrane is healthy. If the cone of light is present, that signifies the tympanic membrane is healthy. And here is the we can see here is the long process of the incus, and here we can see the facial canal. Here is the facial canal. Facial nerve moves through this part of the middle layer through the tympanic membrane. We can see this facial canal. Here is the promontory, and here is the oval window. This is the promontory. This is the oval window. Here will be the round window. These are the structure we can see through the tympanic membrane, and sometimes we can demonstrate. Sometimes we can make sure that here is an impression of opening for the eustachian tube. With the otoscopy, we can see all the things. If there is any fluid in the middle layer, we can see that there is a fluid level in this part. So, as a instrument that help us in the diagnosis of ear disease, one of vital instrument is the otoscope. Through the otoscope, we can see the tympanic membrane, we can see the ossicle. Sometimes we can see the facial nerve, we can see the eustachian tube opening, we can see the fluid, ear, promontory, all the things of the middle ear. So this is a very important thing of examining the ear. And sometimes you can see some form of these graphs. And in examination of your fifth year, we will ask you in OSPI. Momo is trying to give me some message. If any message, then let me know. What is the message? Momo is deleting her message. Is any message? Then you can write me in the WhatsApp. I have the window displaying the WhatsApp, and I'm checking it. And you can also comment in the comment box. If any suggestion, if any question, then let me know. And Momo the seer, you are trying to make some messages. Okay, now you give me the salam. Alaikum assalam. Your roll number is 5. Okay, thank you. And the seer, Momo, or other, if there any seer, you have to put your percentage on my Google Sheet so that we can check how many people. Now we see that 37 people are joining with me, and they are enjoying this class. In this class, I am demonstrating you what are the common conditions of the ENT, and how can we make a diagnosis. What are the diagnostic tools? First of all, we are discussing about the otoscope. Now we are going to the audiometric test. This is the audiogram. In this graph, we can see that there are two curves. What are the curves? If I zoom it, make the zoom. How can zoom it? Okay, fine. I can make the zoom. Okay, I can zoom it little bit. There are different curves in this graph. Here is one curve and here is another curve. Here is one curve and here is another curve. We can see this is the right ear and this is the left ear. What is this graph? With the chiming, we will make you understand this thing. Now, I just orient you how to read it. How to read it. If I am in the live class, in the real class, then I will ask you this thing, how to read this. Okay, next week I will come to you and with my laptop in your classroom. Then I will ask you how to read this. Just see it now. I am not uh, give any description of this picture, and it is for you, and it is a quiz for you. I will ask this quiz in my physical classes. And this is the tympanogram, this is the audiogram where we can see the hearing status. This is the tympanogram. This is the tympanogram. This tympanogram has different forms of the curve. Uh, yeah, yes, you are asking. Thank you, Tanim Iftekhar. You are asking me the what is the difference between right and left tympanic membrane. Okay, uh, okay. Here is not same thing, same thing. Nothing else. Right and left tympanic membrane is nothing but I can just show you the right and left tympanic membrane. Okay. What can be done? How can I rotate this thing? If you can rotate this thing, this is will be the left tympanic. Simple thing. Simple thing is the okay. Here is okay. I can let you know that this is the right, and I can make a Google search for you. Left, left tympanic membrane. In same picture, you can see right and left. Right and left tympanic membrane. We can demonstrate you what is the difference between right and left tympanic. This is a diagram. We can see you where the here is the, here is the right and left tympanic membrane. I'm demonstrating you this thing. Here, can you see this thing? Can you see my window? This window. Can you see this window? I think you are seeing this window. Here is the tympanic membrane and handle of the malleus. This will be the I can right. Right now. Can you see this? Here is the handle of the malleus and it is directed to the left side. And here is the handle of the malleus that is directed to the upper part. Direction of the upper part is the right hand side. So this right hand side and this left hand side makes this tympanic membrane difference that this is the right and this is the left. And here this part is the anterior part, this part is the posterior part. And in this left tympanic membrane, this part will be the anterior part and this part will be the posterior part. And here is the long process of the incas, here is the cone of the light, and here is the cone of the light. All things just difference between the anterior and posterior part, nothing else. Nothing different in this two part. Can you understand? Are you clear? Tanim Iftekhar. This is the right tympanic membrane, and if you just this part is the anterior part, this part is the posterior part. In the left tympanic membrane, this part will be the posterior part, this part will be the anterior part. This is just simple thing. This is the left tympanic membrane, this is the right tympanic. You have to draw and level all these things, right and left tympanic membrane. Okay, these are the tympanic membranes. Now we will go for another investigation. That is the CT scan. You every day when you go to the ward, you can see such type of CT scan images. This is the CT scan of brain, especially the soft tissue. But for the ENT people, we do this type of the bone window in more times, and sometimes we do the soft tissue windows. This is the soft tissue window, this is the bone window. Now I want to see you another thing. Uh, how can we read the images? Just a thing. How can we read the images? Okay. Also, studio system. Yes. I cannot share it. Why I cannot share it? Why I cannot share it? Oh, okay. I'm trying to show you some issues. Um, okay, okay. I'll see. I want to show you the screen, but I cannot share you this image. Can you see this image right now? You are not seeing this thing. I think you are not seeing this thing. Now, can you see? It's still not being seen. Here is okay. Okay, okay, okay. Okay, it is difficult for me to show the real image. What is yes and what is no? I'm not sure. I'm trying to see you the imaging protocol so that you can understand what is image. And I have a target to see you the operation procedures, but it is not uh, feasible for the YouTube live streaming to share my other programs. I can only share the Google Chrome, but I cannot share all the Windows, all the apps. I'm not sure how can do this. I will learn it, then I can show you this thing. I think that this will be the last class. Next week we will be in the physical classes, and you are commenting yes sir and no sir. Screen is not seen. That might be the no, and I am trying to understand you. What is the right tympanic membrane? What is the left tympanic membrane? What are the differences between the right and left tympanic membrane? Uh, uh, yes, yes. I think that it is clear to you what is the difference between right and left tympanic membrane. And you are very much unlucky that previous day I have a meeting in Dhaka, and during this time I could take only 10-minute class. Today, I have also a meeting with the ministry people that will start at the 9. Before the meeting, I have to take some preparation so that today I will not continue the class up to the 9. Uh, I will finish my class within few minutes. Just I will show you. I'm trying to show you all the procedures that we need for the ENT diagnosis, that is the otoscopic examination, the audiometric tests, the imaging, CT scan, MRI, X-ray, and some form of the endoscopy in the see the nose, oral cavity, larynx. These are the endoscopic tools. So I have discussed you the thing about the common clinical conditions, diagnostic tools, now the treatment modalities. How can we make the treatment? What are the treatment modalities for the ENT diseases? ENT is the branch that sometimes deals with some form of emergencies. Our main emergency is the airway emergency. There are some form of the obstruction. There is some form of the airway obstruction that makes the life uh, very dangerous. Mm, in some situations like road traffic accident, some form of the diseases, some form of the trauma, some form of the physical violence that may cause the airway obstruction in the throat, and we have to deal with this type of the emergencies. In the first thing to handle the emergency is the do a tracheostomy in this trachea and uh, make a bypass airway. Our airway system is the from nose to the lungs. From nose to the lungs, our narrowest part of the airway is the larynx. Sometimes some form of edema, some form of pathology can make the larynx more narrow. Then we need a bypass. We need a bypass. We need the larynx to be bypassed. Below the larynx, we make a hole and we insert a tube so that the people can take breath through this bypass area. That is the tracheostomy. That is the main emergency of the ENT. And another types of the emergencies like otitis externa. In the malignant otitis externa, there is some form of and some form of emergency that sudden sensory or hearing loss. Many people, healthy people, adult healthy people, hearing well, but when there is a sudden loss of the hearing, they may get an emergency call. That is the ENT emergency. And some form of the infections in the neck, that space infections like Ladwig angina, they may cause some emergency that produces the airway compromised. This is the emergency, and emergency should be deal with the emergency. And ENT people can give the treatments through the medicines, some medical management prescription. Writing the prescription, we can treat some diseases. We can do surgeries, some form of surgeries in ear, nose, throat, and the head neck. There are different surgeries in the ENT. We can do these surgeries, and after surgery or without surgery, some form of rehabilitation is needed in the ENT people. Rehabilitations like when there is the vertigo in the head and when there is the tinnitus in the ear, we are trying to make some medications, but the medication fail. Sometimes you can try to some form of the surgeries, but that may get failed. After getting this failure, we can make this patient to go to the rehabilitation, some form of the tinnitus retraining therapy, some form of the vertigo therapy. These are the rehabilitations for the ear diseases. And sometimes we have to cut out the larynx. Sometimes you have to cut out the larynx. Then the people need to some form of the speech therapy, or some times there are some benign nodules in the primary stages, and then we need to some form of the speech therapy and some form of the swallowing rehabilitation when there is the dysphagia, and so when there is some aspiration, chronic aspiration, we need to we can give some rehabilitation therapies for these chronic peoples. These are the ENT modalities that helps you to treat the ENT problems. And the ENT people alone sometimes is not adequate to treat the persons. Sometimes there are some collaboration will be needed when there is some form of the neurological defect that involves the ENT as well as the other part of the body. Then we call the neurology, and some of the different cancers in the head neck regions. More than 30% of the cancers of the body are found in the head neck region. This head neck region cancer will be dealt with the oncologist as well as the ENT people, and some form of the therapist that can help this thing. And sometimes one patient may need different modalities, that is known as the multidisciplinary team. Uh, in the previous year, we have made some form of the short questions. What is multidisciplinary team? And especially for the laryngeal disease, what are the multidisciplinary team? that is asked in the written question as a short note. Now, I think this is our final session of introduction to the ENT. What are the common symptoms of the ENT? What are the diagnostic tools of the ENT? What are the instruments used in the ENT? We have discussed all the things. Do you have any questions? Do you have any questions? Let me know. Any any questions? Any questions? Do you have any question? If you have no question, then I want to finish my lecture. I want to finish my lecture right now. Thank you all. Thank you for joining me this class. I hope that next week we will see you in the real classroom, and I think this is the last session on our online classes. Now there are 44 people. Now there are 44 people here. Excellent, but why rest of six people are not coming here? Who are the six guys that are not connected with me? CR, let me know. Let me give the attendance sheet. Fill the attendance sheet and let me know who are the six people that have not joined with us and why they have not joined with us. Uh, give your attendance. I think all the people are commented here with the roll number, and roll number will be counted as the attendance. So thank you all. Thank you very much.